A physiotherapist is a healthcare professional trained to diagnose, treat, and manage movement disorders and conditions related to muscles, joints, and the nervous system. Physiotherapists work with patients to improve mobility, relieve pain, restore function, and prevent injury, utilizing various techniques such as exercises, manual therapy, heat, cold, and education on posture and body mechanics. Physiotherapists' role in pregnancy. During pregnancy, the body undergoes significant changes, which can lead to discomfort and physical challenges. Physiotherapists specialize in addressing these challenges and providing guidance on how to manage them safely. They work closely with pregnant women to alleviate pain, improve posture, maintain flexibility, and optimize body function as the pregnancy progresses. Here's how a physiotherapist works during pregnancy. Assessment and diagnosis. Initial consultation. The physiotherapist begins by assessing the expectant mother's physical condition, medical history, and any pregnancy-related concerns. This includes evaluating posture alignment and any current or past issues such as back pain, pelvic pain, or muscle weakness. Postural assessment. Physiotherapists will often assess how pregnancy affects posture. The growing belly shifts the center of gravity, which can strain the lower back, pelvis, and shoulders. The physiotherapist will check if the body is compensating for these changes and advise accordingly. Pain relief and management. Lower back pain. A common issue during pregnancy is lower back pain due to weight gain, changes in posture, and hormonal changes affecting the ligaments. Physiotherapists can use manual therapy, gentle manipulation of muscles and joints, and teach exercises to strengthen the core and back muscles, improving posture and minimizing pain. Pelvic girdle pain, PGP. This condition occurs when there is pain around the pelvis, typically in the lower back, hips, or groin. A physiotherapist will assess the pelvic alignment and help manage PGP through exercises, stretches, and posture modifications. Sciatica. Some women experience sciatica during pregnancy, which is pain that radiates from the lower back to the legs. A physiotherapist can treat this through stretching, strengthening, and techniques to reduce nerve compression. Breathing and relaxation techniques. Breathing exercises. Physiotherapists teach breathing exercises to improve oxygen flow to the body and reduce tension. These techniques help with stress relief, reduce anxiety, and prepare the body for labor. Relaxation strategies. Techniques such as progressive muscle relaxation can help manage discomfort and increase overall well-being during pregnancy. Pelvic floor health. Pelvic floor exercises, Kegel exercises. The pelvic floor supports the uterus, bladder, and bowels. Pregnancy can weaken these muscles, leading to urinary incontinence or prolapse. Physiotherapists teach specific exercises to strengthen the pelvic floor, reduce the risk of incontinence, and prepare for a smoother delivery and postnatal recovery. Education on pelvic floor health. Physiotherapists provide education on maintaining pelvic health during pregnancy, avoiding activities that may strain the pelvic floor, and guiding women through proper lifting and bending techniques. Strengthening and flexibility. Core strengthening. Strengthening the core muscles is crucial during pregnancy to support the growing belly, maintain balance, and alleviate back pain. Physiotherapists recommend exercises that target the abdominal muscles while ensuring they are safe for pregnancy. Stretching and flexibility. Physiotherapists guide safe stretching techniques to maintain flexibility in the hips, lower back, and legs. This helps improve mobility and can be beneficial during labor by allowing the body to open up and adapt to the demands of childbirth. Postural correction. As the pregnancy progresses, the body's center of gravity shifts, which may lead to poor posture and strain. Physiotherapists educate on the importance of good posture and provide exercises to strengthen muscles, improve alignment, and alleviate discomfort. Exercise programs. Safe exercise guidance. Regular exercise is generally beneficial during pregnancy, as it improves circulation, boosts energy levels, and helps manage weight. Physiotherapists develop personalized exercise programs tailored to the individual's fitness level, ensuring the exercises are safe and appropriate for the stage of pregnancy. Water-based therapy. Aquatic therapy may be recommended for women who experience joint pain or swelling. The buoyancy of the water reduces stress on the joints while providing resistance for muscle strengthening and cardiovascular exercise. Prenatal yoga and Pilates. These practices, often guided by a physiotherapist, focus on gentle stretching, strength building, and relaxation. They help improve posture, flexibility, and mental well-being. Education and prevention. Ergonomics. A physiotherapist educates the pregnant woman on how to adapt her daily activities, such as sitting, standing, and lifting, to avoid unnecessary strain on her body. This includes recommending supportive footwear, the correct way to bend, lift, and sleep positions to prevent pain. Managing swelling and circulation. As pregnancy progresses, swelling in the legs and feet can occur due to fluid retention. Physiotherapists provide advice on circulation-boosting exercises, elevating the legs, and wearing compression stockings to reduce swelling and prevent varicose veins. Preparation for labor and delivery. Labor positioning. Physiotherapists can guide women on labor positions that are beneficial for both comfort and the progression of labor. Positions such as squatting, leaning on a birthing ball, or using a birthing stool can improve pelvic alignment during contractions and encourage optimal fetal positioning. Perineal massage. Some physiotherapists may assist in perineal massage to prepare the perineum, the area between the vagina and anus, for childbirth, potentially reducing the risk of tearing during delivery. Postnatal care. After birth, physiotherapists can help with recovery, focusing on strengthening the pelvic floor, abdominal muscles, and core. They provide guidance on how to regain strength safely and manage post-birth issues such as back pain, diastasis recti, separation of abdominal muscles, and incontinence. Physiotherapy, as a therapeutic practice, has been a crucial part of human health management for millennia. Its applications for pregnant women, however, have evolved significantly over the centuries, with contributions from various cultures and medical systems shaping modern practices. Historical use of physiotherapy in ancient cultures. The concept of manipulating the human body to restore or maintain health is not new. Ancient civilizations, including the Egyptians, Greeks, Romans, and Chinese, utilized physical treatments for a wide range of ailments, including those related to pregnancy. In ancient Egypt, midwives were known to use hands-on techniques during labor to ease the delivery process, manipulating the body to alleviate pain and ensure smoother labor. Similarly, ancient Chinese practitioners used acupressure, massage, and herbal remedies to treat various pregnancy discomforts such as morning sickness, back pain, and swelling. Ancient texts mention specific techniques to manage pain during labor, including certain forms of movement and positioning that resembled early forms of physiotherapy. In classical Greece, the physician Hippocrates wrote about the benefits of exercise, manual therapies, and specific body postures to promote health and alleviate disease. It is from these ancient texts that the foundational concepts of physiotherapy began to develop, even though the specific use for pregnant women would take millennia to materialize in its modern form. The emergence of physiotherapy in the modern era. The practice of physiotherapy in a formalized sense started to emerge in the late 19th and early 20th centuries, driven by scientific advancements in anatomy, physiology, and biomechanics. Physiotherapists began to study the effects of movement on the human body, leading to a more structured and evidence-based approach to healing. It was during the mid-20th century that physiotherapy for pregnant women gained traction. The practice, once seen as an ancillary or complementary form of treatment, became increasingly recognized for its benefits in managing pregnancy-related issues, such as lower back pain, pelvic discomfort, and muscle weakness. Evolution of evidence-based practices. With the rise of modern medicine and the increasing recognition of physical therapy as a specialty, physiotherapy for pregnancy began to shift toward evidence-based practices. As more clinical research was conducted into the physiological changes that occur during pregnancy, physiotherapists refined their techniques to address specific symptoms like pelvic instability, posture issues, and musculoskeletal discomfort. By the late 20th century, physiotherapy had become an integral part of prenatal care in many developed countries, with practitioners working alongside obstetricians to provide holistic treatment plans. In the modern world, physiotherapy is no longer an alternative or secondary treatment option for pregnant women, but a standard part of prenatal health care in many regions. Research continually supports its benefits, showing that physiotherapy not only alleviates physical pain, but also contributes to better maternal outcomes, such as shorter labor times and improved postnatal recovery. Benefits of physiotherapy for pregnant women. Physiotherapy offers numerous benefits for pregnant women. These benefits extend beyond pain relief, touching on many aspects of physical, mental, and emotional health. Physical health benefits. Pain management. One of the primary reasons pregnant women seek physiotherapy is to manage musculoskeletal pain. The added weight of pregnancy, combined with changes in posture and increased ligament laxity, can lead to chronic pain in areas such as the lower back, hips, and pelvic region. Physiotherapy provides relief through manual therapy, targeted exercises, and postural correction techniques that address these issues. Muscle strengthening. As pregnancy progresses, the body undergoes significant changes that strain muscles and joints. Physiotherapists guide patients through exercises that strengthen core, pelvic, and back muscles, helping to prevent injury and ease the demands placed on the body during pregnancy and labor. Posture correction. Pregnancy causes an anterior shift in a woman's center of gravity, which places strain on the lower back and upper body. Physiotherapists teach exercises and stretches that help correct posture, reducing pain and preventing further complications, such as spinal misalignment. Pelvic floor health. The pelvic floor is under considerable strain during pregnancy, which can lead to incontinence and pelvic organ prolapse. Physiotherapy offers specific pelvic floor exercises to strengthen the muscles responsible for bladder control and support for the uterus and other pelvic organs. Improved circulation. Swelling and edema are common in pregnancy due to the increased blood volume and pressure on the veins. Physiotherapists guide women through exercises that improve circulation, reduce swelling, and help prevent conditions like varicose veins and deep vein thrombosis, DVT. Mental and emotional health benefits. Stress relief. Pregnancy can be stressful, both physically and emotionally. Physiotherapy often incorporates relaxation techniques, including deep breathing and mindfulness exercises that reduce anxiety and help the mother maintain emotional equilibrium. Improved sleep quality. Many pregnant women struggle with sleep due to physical discomfort or anxiety. Physiotherapy helps alleviate physical discomfort through posture correction and muscle relaxation, which can improve the quality of sleep. Better body awareness. Physiotherapy helps women develop better body awareness, teaching them to listen to their bodies and understand what movements or postures relieve discomfort. This self-awareness also aids in preventing unnecessary strain and injury. Preparation for labor. Physiotherapy helps pregnant women prepare for the demands of labor. Through exercises that focus on muscle endurance and flexibility, as well as breathing techniques, physiotherapists help women prepare their bodies for a more efficient and less painful labor process. Indications for health-related applications of physiotherapy in pregnancy. Several health-related conditions can benefit from physiotherapy during pregnancy. These include musculoskeletal issues, cardiovascular health, mental health, and others. Chronic back pain. Physiotherapy is often recommended for chronic back pain, a common complaint during pregnancy due to hormonal changes and the increased weight of the baby. Specialized exercises can strengthen the muscles supporting the spine, alleviate discomfort, and prevent long-term postural issues. Gestational diabetes. Gestational diabetes is another common pregnancy-related health concern. Physiotherapy has been shown to help regulate blood sugar levels through controlled physical activity, which helps improve insulin sensitivity and reduce the risks associated with gestational diabetes. Edema and swelling. Swelling in the legs and feet is common in pregnancy due to fluid retention. Physiotherapists use a combination of exercises and manual techniques, such as lymphatic drainage massage, to help reduce swelling and improve circulation. Pelvic girdle pain. Pelvic girdle pain occurs when the joints in the pelvis become unstable during pregnancy. Physiotherapy focuses on strengthening the pelvic region and improving stability through targeted exercises, reducing the pain and preventing further injury. Urinary incontinence. Pregnancy can weaken the pelvic floor muscles, leading to urinary incontinence. Physiotherapy teaches pelvic floor exercises to restore strength and control, reducing the occurrence of incontinence during and after pregnancy. Mental health concerns. Pregnancy can be a stressful time, and some women experience mental health challenges, such as anxiety and depression. Physiotherapists may incorporate relaxation techniques, breathing exercises, and mindfulness practices to reduce stress and improve emotional well-being. Indications for organic health during pregnancy. The benefits of physiotherapy extend beyond musculoskeletal concerns to support various organic health systems, including the cardiovascular, respiratory, digestive, and endocrine systems. Cardiovascular health. Pregnancy places additional strain on the cardiovascular system, with increased blood volume and changes in heart rate. Physiotherapy helps support the cardiovascular system through gentle exercises, improving heart health, circulation, and overall endurance. Respiratory system. As the pregnancy progresses, the growing uterus pushes against the diaphragm, causing shortness of breath. Physiotherapists teach breathing exercises to help women maximize their lung capacity and manage breathing difficulties. Endocrine system. Pregnancy triggers significant hormonal changes, and physiotherapy can help women manage these changes by promoting healthy physical activity that supports the endocrine system. Exercise has been shown to regulate hormones, improve mood, and support overall metabolic health. Digestive system. Many pregnant women experience digestive issues such as constipation or bloating due to hormonal changes. Physiotherapy helps stimulate the digestive system through targeted exercises that promote bowel movements and reduce discomfort. Indications for organic systems. In addition to the musculoskeletal system, physiotherapy also benefits various organic systems, including the vascular, nervous, and lymphatic systems. Vascular system. Pregnancy leads to changes in the vascular system, increasing the risk of venous stasis and varicose veins. Physiotherapy helps improve blood flow, prevent DVT, and reduce swelling through exercises and manual techniques. Lymphatic system. Physiotherapy promotes lymphatic drainage, which helps reduce the swelling caused by pregnancy. By encouraging gentle movement and manual drainage techniques, physiotherapists support the body's detoxification processes. How physiotherapy for pregnant women can help during pregnancy and childbirth. Physiotherapy plays a transformative role in both pregnancy and childbirth. It helps not only in managing pain and improving physical function during pregnancy, but also in preparing women's bodies for the demands of childbirth. Here's a breakdown of how physiotherapy supports various stages and challenges of pregnancy and labor. Early pregnancy support. During the first trimester, physiotherapists focus on gentle, low-impact exercises to support overall strength and flexibility without adding stress to the body. These exercises lay a foundation for muscle endurance, which becomes crucial as the body starts to carry more weight. Women often report increased energy levels, improved mood, and less nausea when they maintain gentle activity early in pregnancy, all of which are positive outcomes facilitated by physiotherapy. Management of morning sickness. Physiotherapists can help with techniques such as acupressure and gentle movement therapies, which can alleviate morning sickness. Studies have shown that these non-invasive methods can decrease nausea by stimulating specific pressure points and increasing circulation, offering relief without the need for medication. Preventing musculoskeletal issues. As the body undergoes rapid changes, the added weight and shifted center of gravity can lead to musculoskeletal strain, primarily affecting the back, hips, and legs. Physiotherapists help manage these adjustments with targeted strengthening and stretching exercises that address posture, relieve pressure on the spine, and improve muscular balance. For example, exercises that target the lumbar spine and pelvic area can significantly reduce discomfort, providing stability and mobility as the pregnancy progresses. Strengthening the pelvic floor. Physiotherapy places a strong emphasis on pelvic floor health during pregnancy. A strong, flexible pelvic floor can make a remarkable difference in labor, as it supports the baby's descent and reduces the risk of complications. Physiotherapists guide women through exercises that isolate and strengthen the pelvic floor, using methods such as Kegel exercises, functional movement patterns, and breathing techniques that train the body to engage these muscles effectively. Core strengthening and abdominal health. Core stability is essential during pregnancy, not only for comfort, but to prevent issues such as diastasis recti, separation of the abdominal muscles. Physiotherapy focuses on safe, targeted exercises that maintain core strength without placing excessive strain on the abdominal muscles, which are under immense pressure as the uterus expands. Pain management techniques. Physiotherapy is instrumental in managing the different types of pain associated with pregnancy. Lower back pain, sciatica, and pelvic girdle pain are all common complaints. Physiotherapists use techniques such as gentle spinal mobilization, myofascial release, and other manual therapies to reduce pain and improve movement. For example, myofascial release techniques alleviate tightness and improve blood flow, providing immediate relief while facilitating long-term pain management. Managing swelling and edema. Swelling, especially in the legs and feet, is common in the later stages of pregnancy. Physiotherapy addresses this by incorporating exercises that stimulate circulation and reduce fluid retention. For instance, exercises like ankle pumps, calf stretches, and gentle leg movements encourage blood flow, helping to alleviate the discomfort of swelling. Some physiotherapists also use lymphatic drainage massage, a gentle technique that promotes fluid movement and reduces edema. Breathing techniques for labor preparation. Physiotherapists often incorporate breathing exercises into prenatal care, which not only helps with relaxation but also prepares women for the demands of labor. Proper breathing techniques can help manage pain, promote efficient oxygenation, and maintain calmness during childbirth. Techniques such as diaphragmatic breathing or deep belly breathing encourage relaxation and focus, which are valuable tools during labor. Exercise and endurance training. Labor can be physically taxing, and physiotherapy helps women build the endurance needed to cope with prolonged labor. Physiotherapists guide patients through exercises that enhance cardiovascular fitness without overloading the body, such as low-impact aerobic exercises, water-based activities, and resistance training. These exercises improve stamina, strength, and flexibility, all of which are beneficial during childbirth. Manual therapy and pain reduction techniques. Manual therapy, including soft tissue massage and gentle joint mobilizations, helps relieve pain and reduce tension in specific muscle groups. These therapies are particularly useful in addressing areas that experience strain due to pregnancy-related weight gain and postural changes. For example, sacroiliac joint mobilization and lower back massage are common interventions that relieve tension and improve comfort. Labor preparation and positioning. Physiotherapists can teach specific positions that facilitate labor, reducing discomfort and improving the efficiency of contractions. Positions that promote the descent of the baby, such as squatting or side lying, can be practiced and perfected with the help of a physiotherapist, making them easier to adopt during labor. Preventing and managing varicose veins. Varicose veins are common in pregnancy due to increased pressure in the veins and hormonal changes. Physiotherapy offers exercises that improve circulation, such as leg elevation and calf raises, and educates women on compression techniques that reduce vein pressure and swelling. Postural correction for birth readiness. Physiotherapy helps correct any postural misalignments that may hinder the labor process. By ensuring that the body is balanced and well aligned, physiotherapists help optimize the pelvic and spinal alignment, which can facilitate a smoother labor and reduce the risk of complications. Addressing psychological well-being. Physiotherapy for pregnant women isn't limited to physical adjustments. It also has profound mental health benefits. Physiotherapy sessions often incorporate relaxation techniques, breathing exercises, and mindfulness practices that help reduce anxiety and promote a positive mental state, which can contribute to a better pregnancy experience. Developing mobility and flexibility. Pregnancy and labor require flexibility and mobility, especially in the hips and pelvis. Physiotherapy incorporates stretching exercises that improve flexibility, such as hip openers, pelvic tilts, and lower back stretches. Increased flexibility in the pelvis is associated with easier labor and less pain. Education on body mechanics and safe movement. Physiotherapists educate pregnant women on safe body mechanics to avoid strain and injury. Simple actions, such as lifting, bending, and standing for prolonged periods, can be challenging during pregnancy. Physiotherapists teach ergonomic strategies and movement modifications that reduce the risk of injury. Water-based therapy for low-impact exercise. Hydrotherapy or water-based physiotherapy provides a safe environment for exercise. The buoyancy of water reduces pressure on joints, making it an ideal environment for pregnant women to engage in cardiovascular and strength exercises without risking injury. TENS for pain relief during labor. Transcutaneous electrical nerve stimulation, TENS, is often used during labor as a non-invasive pain relief option. TENS works by sending low-voltage electrical currents through the skin, which can help block pain signals to the brain. Many physiotherapists teach women how to use TENS machines, as they are safe and effective for managing labor pain without medication. Preparing for postpartum recovery. Physiotherapy for pregnant women often includes preparing for postpartum recovery. Exercises that strengthen the pelvic floor, core, and overall muscle endurance are essential to minimize postpartum discomfort and aid in recovery. Encouraging a supportive birth environment. Many physiotherapists work collaboratively with midwives and doulas to create a supportive environment for birth. By providing holistic care and addressing the emotional and physical aspects of pregnancy, physiotherapists contribute to a positive birth experience. Contraindications and precautions in physiotherapy for pregnant women. Despite its benefits, physiotherapy is not suitable for all pregnant women. Certain conditions and situations require caution or may contraindicate the use of specific physiotherapy techniques. Here are some common contraindications and precautions. High-risk pregnancy. Women with high-risk pregnancies, such as those with preeclampsia, placenta previa, or severe gestational hypertension, should avoid intense physical therapy and consult their healthcare provider before beginning any physiotherapy program. Incompetent cervix. A diagnosis of cervical incompetence often requires bed rest or limited physical activity, which means that traditional physiotherapy exercises may not be safe. Instead, a modified, gentle approach may be considered, but only under medical guidance. Multiple pregnancy. Twins or more with multiple pregnancies. There is often increased risk of premature labor and other complications. Physiotherapy is possible, but it must be tailored to avoid excessive strain. Persistent bleeding or spotting. Women experiencing bleeding should consult with their healthcare provider before engaging in physiotherapy. Certain exercises, particularly those that increase intra-abdominal pressure, may exacerbate bleeding and are generally avoided. Diabetes-related complications. Gestational diabetes can complicate pregnancy if not managed carefully. Physiotherapists will work with the medical team to ensure that any physical activity is safe for both mother and baby. Previous preterm labor. Women with a history of preterm labor may need to avoid certain types of exercise that could stimulate contractions. Low-impact, supervised physical therapy is typically recommended. Severe anemia or blood disorders. Anemia can lead to dizziness and fatigue, which may increase the risk of falls and injury. Physiotherapists will take special care to avoid any activities that may exacerbate these symptoms. Physiotherapy for pregnant women encompasses a broad range of techniques and approaches that address the multifaceted needs of the pregnant body. It combines a deep understanding of anatomy, physiology, and the unique demands of pregnancy to support women through the profound journey of childbearing. This intervention not only alleviates physical discomfort, but also prepares the body for labor and fosters mental well-being. Physiotherapists provide individualized care, guiding women through exercises, pain relief methods, and relaxation techniques, all of which aim to improve the quality of life during pregnancy. In a global context, physiotherapy for pregnant women reflects the ongoing commitment to safe, effective, and holistic care that respects both the physiological and emotional dimensions of pregnancy.